Next slide, Steph. So I'll go through the agenda here in a moment, but before I do, I just want to highlight the Q&A button at the bottom. Please feel free to use that. If you have questions, we will try to get to as many as we can towards the end of the session today. So our agenda for today is that we will go through introductions. I will share a little bit more about Stepping Up, the Stepping Up initiative in general, for folks that are less familiar. We will talk about the intersection of behavioral health and juvenile justice and the relevance to stepping up. And then we will go into the details of the Stepping Up initiative, Stepping Up for Youth initiative in Kansas. And then we will turn it over to our partners who we're joined by today from our Kansas agencies that will talk a little bit about what this project has looked like for them and their perspectives and experiences. And then, of course, as time allows, we will answer any questions that come up along the way. Next slide, Steph. So I'm Megan Davidson, and I have the pleasure of introducing our panelists today. I am a program director in the Behavioral Health Division at the Council of State Governments Justice Center. I'm joined by my colleague, Steph Uberall, a deputy program director in the Corrections and Reentry Division at CSG. And we are pleased to be joined by our partners that have walked alongside us with this Stepping Up for Youth initiative in Kansas. We have Ashley Brown, the Crossover Youth Policy and Practice Coordinator with the Kansas Department of Children and Families, Destiny Gillian, the Justice Involved Services Coordinator with the Kansas Department for Aging and Disability Services, Clay McCarter, the Director of Special Projects and Early Intervention with the Kansas Department of Corrections, and Mario Salinas, the Deputy Director of Juvenile Programs with the Sedgwick County Department of Corrections. Again, so excited to have these folks join us today to talk about this important work that we're doing together. Next slide, Steph. So for people that are less familiar with the Council of State Governments, we are a national nonprofit, nonpartisan organization that combines a membership association with policy and research expertise to develop strategies that increase public safety and strengthen communities. Next slide, Steph. How we do that is we bring people together, such as what you're going to hear about today, where we brought a bunch of different agencies together to really see what we can do to create something to solve a really complex and prevalent issue. We also drive the criminal justice field forward with original research. We build momentum for policy change, which you will also hear us talk about today. And we provide expert technical assistance, which we'll also speak about. Next slide. This particular project, as I mentioned, sort of involves this intersection of juvenile justice and behavioral health. So within CSG, we have different teams that do a number of different projects focused on different areas. And so this particular project brought together our juvenile justice team and our behavioral health team. Our juvenile justice team does a lot of different work at the intersection of juvenile or across the juvenile justice spectrum. And it's really focused on helping counties and states really but implement best practices to improve outcomes for youth and families and improve public safety as well. Next slide. The Behavioral Health Division has a number of different initiatives that you may have heard of if you're familiar with CSG, from expanding first response to the Judges and Psychiatrists Leadership Initiative, our Zero Returns to Homelessness, a number of different initiatives that really look at that intersection of behavioral health and justice. And our focus for today will be talking about stepping up. Next slide. So we can go ahead to the next one. So before we dive into talking about the Stepping Up for Youth initiative, we think it's important to lay the groundwork to talk about the Stepping Up initiative at large. And Stepping Up really launched in 2015, so we're celebrating our 10-year anniversary this year, which I'll talk more about momentarily. But it is a national initiative that's focused on strengthening local coordinated responses to safely reduce the overrepresentation of people with behavioral health needs in jails. It's all about bringing cross-systems partners together and helping them use data to identify and address these needs of people that are cycling through our local jail systems. This initiative is a partnership between the Justice Center, the American Psychiatric Association Foundation, and the National Association of Counties. Next slide. Stepping Up was really born out of an issue that many, I'm sure, on this call are very familiar with, the high prevalence of people that are cycling through our local jail systems with serious behavioral health needs and SMI specifically, serious mental illness specifically. When we look at those prevalence numbers and some of the estimates that have been generated over the years through different studies, we apply them to statistics today, you're looking at about of the 8 million bookings to jail annually, about 1.3 million of those involve people with serious mental illness. Estimates really put this between 15 and 20% when we add in other behavioral health needs, co-occurring substance use needs, et cetera. Those numbers, of course, go up. But the real issue here is that it was an issue 10 years ago. That's what launched Stepping Up. It continues to be an issue. We've learned a lot over the years working with many of our counties and are excited about sharing some of that with you. And but that is really what really started Stepping Up and really is the core focus of Stepping Up is helping counties address this issue. Next slide. So what does stepping up look like for folks that are less familiar? It really involves several key pillars. The first pillar is a framework. We have worked over the years with many experts and counties and people doing this work to develop a framework and supporting resources that can guide counties in their local efforts to address the issue, that those prevalence numbers and what they can do to help address that. And so on our website, you will see a number of different resources, and we'll drop that in the chat as well when I get done talking, where you will see a number of resources that really serve as a roadmap to help counties walk through that process. It is considered sort of a DIY, do-it-yourself framework that counties can pick up and run with and adapt to their local circumstances. In addition to that, Stepping Up is a data-driven initiative, so we do have several key metrics and associated guidance that we encourage counties to track that are involved in stepping up that can help them really assess their progress and identify, where they might want to make policy or practice changes and et cetera. So those are kind of the two cornerstones of stepping up. But I mentioned this previously, and I'll mention it again, that really the core piece or the cornerstone of stepping up is that cross systems collaboration, bringing behavioral health stakeholders together along with criminal justice stakeholders, getting them at the table, developing a work group, a council that can sit together and talk about strategies, share data, and discuss solutions together. So in addition to the framework and the key metrics, over the years with Stepping Up, we have developed a repository of best practice strategies at the intersection of mental health and criminal justice. And that is in our strategy lab, which also I'll drop a link in when Steph starts talking. And there you can go and find a number of different best practice examples across different intercepts in the justice system, from crisis response to jail to diversion to reentry, et cetera. So that is one of the things that we have accumulated over the years with Stepping Up. And then finally, but perhaps most importantly, is our network of counties. This really is the heartbeat of Stepping Up. We have over 580 counties that have committed to Stepping Up, and they learn from each other. We also work with them to take the lessons that they've learned and put them in resources and highlights and webinars like this that can share what people are doing across the country. And of those, we've got 50 innovators that are our leaders, our champions across the country, innovator counties that really take the lead and are our thought partners and brain trust, quite frankly, with Stepping Up. So that network of counties, it really cannot be understated, the importance of that and how heavily we value that network and how well they value each other. And then our role within CSG is to provide training, technical assistance, and capacity building for all counties that are current Stepping Up or prospective Stepping Up counties. And we've been doing that in a more focused way with our Stepping Up Technical Assistance Centers, one of which does operate in Kansas. And that is really what led to the development of the Stepping Up for Youth initiative. Next slide. So this sort of reiterates some of the points I made about us hitting our 10-year mark this year. That really shows the breadth and extent of Stepping Up and being over 580 counties, over 48% of people live in a Stepping Up county. We've got those 50 innovators that are really blazing the trail around data collection and best practices. So that really is Stepping Up in a nutshell. And I mentioned the state initiatives, and that is really what started our partnership with Kansas. Was we launched a Stepping Up TA center with them, technical assistance center with them several years ago. And through that, we really started to learn, what's happening on the ground, and we can work with them very closely. So as we are hitting our 10-year mark, we're so excited about continuing to grow, stepping up and expand and bring on new counties, continue to increase our innovator county network, and also to expand to the youth setting. So that is what we're here to talk about today. So I will pass it over to you, Steph, to take it away.
Megan. So now I'm going to share just some general background on behavioral health and youth to help ground our conversation. So, what we see in the youth space is that young people have the same needs as adults, right? Where the majority of young people in detention have a mental health need that is not comparable to the general population of youth. So it really deserves a targeted approach for us to figure out how to serve these young people in a more effective, health-centered way rather than just a justice response. And what we see in the research is that it really supports this thinking as when we see that we divert low and moderate risk youth from the juvenile justice system. This is both young people with and without behavioral health needs. We see much better outcomes for youth and safety. So, for example, there was this large scale research study that demonstrated that when low and moderate risk youth are processed in the juvenile justice system instead of being diverted, we see much worse outcomes across a variety of indicators, like they are more likely to be arrested and incarcerated, they are more likely to engage in violence and have peers that are involved in the juvenile justice system. They have lower school attainment and graduation rates. They have fewer coping skills and abilities and skills to manage their emotions, and just overall lower perception of opportunity in their life. And so now I'm going to talk a little bit about the overview of our Stepping Up for Youth initiative in Kansas. And so, given what we were seeing in the field, that young people with behavioral health needs were experiencing detention, we were hearing from detention directors across the country that more and more young people with higher behavioral health needs were entering detention, and it was not an appropriate setting for them, and they were not equipped to handle these young people, but they were ending up in detention because they had nowhere else to go. So we wanted to respond by adapting the Stepping Up for Youth framework, the Stepping Up framework for young people. And so as we were thinking about this, we approached Kansas, as Megan mentioned, we have a long-standing relationship with the Adult Technical Assistance Center, and we also supported some of their comprehensive juvenile justice reform years ago. In addition, Kansas has many foundational elements that we thought we could help leverage and coordinate to really strengthen these approaches for young people. So we partnered with these three state agencies, KDOC, KDADS, and DCF, to really begin thinking about how we could implement Stepping Up for Youth in their state and engage in a 3-year partnership to take this work on. And so we grounded this effort with the goal of supporting cross-system collaboration to ensure young people had access to meaningful and effective behavioral health services in the community. This is true for whether young people were involved in the justice system or at risk of justice involvement. And I think what's really special about this initiative is we're working at both the state and the local level. So we're working at the state level to support policy and funding changes, in addition to supporting counties at the local level implement new and effective approaches. So at the state level, we formed a statewide task force comprised of the elected officials, the governor's office, judges, law enforcement, local and state agency leaders, advocates, and others to really guide a state assessment of policies, funding, and collaboration efforts, which then resulted in a set of recommendations that work to align policies and funding with best practices that can really help advance behavioral health outcomes for young people in Kansas. And I'll talk more about some of those recommendations in a little bit. And so to ensure we were working comprehensively, we also conducted system mapping across 4 state agencies, reviewed policies and statutes, and facilitated listening sessions with about 150 people that work on the ground with young people every day in Kansas to really hear their perspectives on what was working really well and where were there opportunities for improvement in this space. And then at the county level, we formed a working group that adapted the Stepping Up framework for youth and launched our Technical Assistance Center, which is now working with 7 counties to pilot the framework. This includes building local cross-system teams, conducting system mapping, and more to identify how to better serve young people in their communities that have behavioral health needs and justice involvement. And Megan will share more about this later on. And so these pilot sites will also serve as key feedback mechanisms for some of the statewide policy changes that we're currently working on to ensure that we are grounding any policy change in local lens. And then we will expand the Technical Assistance Center statewide. And so we're really excited about the future of this initiative in Kansas. And so, while the adult model of stepping up is kind of more focused on diverting people from jail, and for this initiative, we really looked at the entire continuum of justice involvement, to really understand how young people with behavioral health needs are being served across the intercepts. And so I'm going to talk a little bit about the key findings that we found from our state assessment. And the overarching findings were really that young people in Kansas were entering the juvenile justice system and had behavioral health needs. And we found that many of the young people in Kansas were low and moderate risk, really citing the need to be able to better serve these young people in the community and divert them from the justice system if possible, given the research I shared earlier in the presentation. We found that more than 2/3 of young people on supervision in Kansas were low and moderate risk, but these young people had significant behavioral health needs. The second is that there isn't an intentional cross-system strategy to address youth needs in the community, and this results, unfortunately, in young people ending up in detention or the correctional facility as their risk and needs escalate. And so I'm going to share a few key data points. So we found that 2/3 of young people in Kansas that had a major depressive episode did not receive mental health services. And more so, about 85% of young people in detention screen positive for behavioral health needs. So, really highlighting the need for better solutions for our youth and targeted behavioral health supports. And then at the deepest end of the system, we see the same pattern. So at the juvenile correctional complex, there 77% of young people have a mental health diagnosis, 43% have a significant mental health diagnosis, and 41% are taking psychotropic medication. So this really frames a need for better interventions that match youth needs in the community because, again, we found that less than half of young people placed in the juvenile correctional complex were at high risk to reoffend. So, in taking the findings from the assessment together with the research, we proposed a set of recommendations to agency leaders and the task force that we felt could better serve young people with behavioral health needs in the community. And so I'm going to outline 2 of the major recommendations. So the first recommendation is to develop an early intervention system for young people in Kansas, with the goal of really working to prevent system involvement for young people by making services more accessible and also serving young people that are involved in the justice system more effectively. And some of the concrete things include things like expanding Medicaid to cover evidence-based models for young people, like FFT, expanding crisis respite supports at the front door of the juvenile justice system to prevent detention and justice involvement, and ensure there are youth-specific approaches and peer-based staffing models at the CCBHCs across the state. The second large-scale recommendation is to develop statewide detention standards to support detention centers in implementing best practices across a variety of topics like reentry, behavior management, family engagement, isolation, things like this. And this really builds on some of the efforts that are already underway, including the juvenile detention centers participating in performance-based standards and are currently implementing behavioral health screening to identify young people with behavioral health needs and connecting them to the CCBHCs in their community. And the CCBHCs are also working directly in the detention centers. In addition, part of the goal is to develop alternative detention strategies that keep young people out of detention, especially when they are in crisis. Megan, I will pass it back to you.
Thanks, Steph. So a lot of work happening across the state level and the local level. I think that is what has really been interesting and critical, quite frankly, about this initiative specifically, is that there has really been two streams of work happening at the same time. The state level work that Steph just outlined and the local work that I'll talk about. And I really think that that is setting Kansas up for long-term success, where you don't have the state doing something that the local sites aren't able to implement and or vice versa, right? Where there's not sustainable support at the state level for local efforts. We've seen that happen, where one car is moving farther than the other, so to speak. But this way they're moving together, and I think that's really going to set Kansas up for success. So I'll speak a little bit about our pilot sites and the work that we're doing with them. So next slide, Steph. So Steph spoke a little bit about this, but in 2023, as the work with the state assessment was underway, we were also partnering with a local work group that consisted of key stakeholders from local juvenile justice and behavioral health entities, as well as child welfare entities, et cetera, that we brought together to say, okay, help us take the stepping up framework as is and adapt it to the youth setting, recognizing that there are unique players, there are unique aspects, certainly youth and families very different than adults when we're talking about how to develop strategies, to meet these needs. So we met with that work group multiple times and took the initial stepping up framework and adapted it for the youth setting. Throughout that, we also selected several pilot sites. Steph mentioned that we have 7 sites that we're working with to test and refine the framework. Before rolling it out more broadly, we really wanted to hear from counties doing the work. How does this land with you? How are there specific pieces that you would tweak or refine? So before rolling that framework out and developing a bunch of resources around it, we really wanted to hear from them what was working and not working with the framework so that when we do roll it out more broadly, it is informed by practice and reality. So cannot thank those pilot sites enough. Some may be on this call. Mario represents one of those pilot sites. They've really been instrumental in helping us conceptualize this work and will continue to be instrumental in helping us refine that. And part of the stipulation for becoming a pilot site was that they had some cross systems buy-in going into it. So they already had buy-in from their local behavioral health partner, as well as their juvenile justice, whether it be their detention center or their kind of juvenile justice counterpart locally that could say, okay, we're ready to buy into this and we're going to do this. Because really that's the foundation of the work, as I've mentioned previously, is bringing these folks together. They also had to have a commitment to collecting data and using that data. So if they weren't currently collecting the data that, was going to be relevant, that they had a commitment to building that capacity to develop that data or to capture that data and share that data, quite frankly, because that's an important part of it. Cross systems data sharing, which we all know can be certainly challenging, is the work that we're doing. So as we're rolling out this pilot that started in early 2025, getting pilot sites up and running, we are now providing TA, technical assistance, to those pilot sites to help them implement the Stepping Up for Youth framework. You'll see us call it SUY. That's sort of our shorthand for the Stepping Up for Youth initiative. So we're currently working with them. We'll be working with them through the end of this calendar year and moving. We're going to roll this out more broadly to Kansas statewide, so that any county that's interested in implementing Stepping Up for Youth has the materials and support to be able to do that. So that's our game plan within the Stepping Up for Youth kind of framework with Kansas specifically. Next slide. These are our pilot sites here. We've got Barton, Seward, Sedgwick, Shawnee, Franklin, Johnson, and Bourbon counties. These do represent urban and rural areas, which has been really nice because we wanted to make sure that we weren't just testing the framework with high-resourced counties, but that we were also testing it with you know, these counties that have a different varying capacity and different sort of issues that they're dealing with. So we again can't give a shout out enough to our pilot sites for participating and being a part of this project. Next slide. So I'll give a little bit of a sneak peek into the framework and sort of what is it that our Stepping Up for Youth looks like and how these counties are starting to implement that. I do want to give time to our speakers to speak about their experiences, so I won't go into all of the nuts and bolts of it, especially because some of this we're still refining. But the overarching framework involves really three main components. There's a set of guiding principles that is based on extensive literature in the juvenile justice world, and it is intended to help really set guardrails for them. So we're saying, okay, make sure that when you are implementing strategies under the Stepping Up for Youth umbrella, that they follow these guidelines. Things like make sure it's strength-based. Make sure it's trauma informed. Is it youth and family centered? Is it well coordinated and research based? Those are the principles that we want the Stepping Up for Youth sites to be following. The next component is essential questions to guide the work. If anyone is familiar with the Stepping Up initiative and our framework, there are 6 key questions that are a part of the Stepping Up framework that we encourage counties to ask themselves. And within both the Stepping Up original framework and the Stepping Up for Youth framework, we provide a lot of guidance about how one would go about answering those questions. So it's just really a roadmap. The essential questions is really the framework, the roadmap for counties to be able to step by step kind of guidance for how you go about addressing this intersection of those behavioral health needs in kids that are entering detention. And then thirdly, similar to the Stepping Up initiative, there are key data indicators that we're encouraging the counties to track and utilize for decision making. Some of those parallel are adult measures, things like reduced recidivism, reduced length of stay, reduced admissions, and increased connections to care. Those are our 4 key metrics for stepping up. But we're also incorporating some other more short-term process measures, intermediate measures that are more youth focused as well. So next slide. So in some ways, it's really staying true to the Stepping Up initiative, and in some ways, we're certainly trying to adapt to the youth setting. So these are the 4 questions that serve as the roadmap for the Stepping Up for Youth framework. The questions do parallel to some degree the Stepping Up framework in general, but it's a little bit of a different package if you're familiar with that framework. So the questions that we're encouraging counties to ask themselves, and we provide a lot of guidance as to how you can go about answering these questions, is do we have cross systems buy-in and consensus? If we're trying to make systems change happen and certainly make it sustainable, we need to make sure that all the players are on the same page. And so that involves things like pulling together a work group and developing a mission and vision and a charter that can make sure that you're on the same page and have that collective buy-in. The next question is about how do our current processes and strategies align with best practices? So doing some mapping of what does this process currently look like for kids that are at risk for or currently involved in the juvenile justice system that have behavioral health needs? How are we currently identifying those needs? Where are there opportunities, off ramps for those kids to get connected to services? And how can we find ways to implement additional best practices to strengthen the work that we're doing locally? And then thirdly, what data tracking and reporting infrastructure is needed to measure and achieve shared goals. So this is all things data. What data do we currently have? What data do we need to have to be able to track our goals and make sure that we are having the intended impacts that we're hoping to have? And what MOUs do we need to establish? Who's sharing what? Who's going to be responsible for bringing what data points to the table? And how can we get on the same page about that? And then finally, how do we monitor and adapt our policies and practices over time? This is sort of the continuous quality improvement piece of the Stepping Up framework. So stepping up, the original Stepping Up framework and the Stepping Up for Youth is intended to sort of be perpetual. So it's not a program that is time limited. It's intended to be something that gets baked into the local framework, the local infrastructure, so that you've got a work group or a council that's meeting routinely to talk about this issue, to evaluate the data. What's the data telling us about this or that strategy that we've implemented, and how do we want to continue to adapt and monitor this stuff over time? So making sure that you've got those processes in place to really evaluate things over time. So those are the four key questions that we provide a lot of guidance around, and that we're refining with the work group or the pilot sites right now. Next slide. So our pilot sites are sort of, I would say, midstream with the stepping up for youth kind of framework testing and really getting in the weeds with all of this. Many of them have started organizing a cross systems team. They've identified a coordinator, somebody that's going to help corral everyone and make sure folks are attending meetings. They have started developing their missions and vision and their charter, and what are our goals and how do we want to achieve those goals. In addition, some of our pilot sites have started doing their system mapping across agencies to really identify where are we currently intervening with kids that have behavioral health needs that are at risk for or currently involved in the juvenile justice system, and where are there opportunities for us to incorporate new strategies. Eventually, they will be moving to identifying those areas of improvement and developing an action plan and looking at their data. So, sort of the next phase of work that we're doing with them is digging into the data and exploring what data indicators they have and what they can use to inform their action planning and the start of their continuous quality improvement work together. Next slide. So that is sort of a summary, a quick summary of the work that we have been doing with Kansas at the local and state level. Again, cannot express our appreciation enough for our partners at both levels that have really helped shape this. And now it's time to hear from them. So I'm going to open the floor and start kicking it off to our partners, because we want to have them share a little bit about their experience and what their goals are, how this work intersects with their other efforts that they have going on. So with that, Clay, I will kick it over to you to share the KDOC perspective, if you don't mind taking it away.
Hey, good afternoon, everyone. At least it's afternoon in Kansas anyway. I just wanted to say, before I really start talking too much, just say a quick thank you to Megan and Stephanie for just giving us the opportunity to talk, and just give you guys a little bit of insight into the work that we're doing in Kansas. And before I get into some of my points, I wanted to mention one of the questions. There was a question that was put in the Q&A asking if any of this work is connected to the JDAI probation transformation work. So Kansas was involved in the Juvenile Detention Alternatives Initiative 11, 12 years ago, probably when we first started into that work. We had several, I think 5 counties that were participating in JDAI, but Kansas has never delved into the probation transformation side of JDAI. I think that's kind of maybe like a little bit of an offset of their original model. And so Kansas has never gotten into that. I won't say that we never will, but just something that we haven't dived into yet at this point. So for me, I was more or less the project manager, I guess, for the state for stepping up, and so a lot of the local work I wasn't necessarily a part of, and I wasn't able to participate in every single conversation. A lot of my involvement was more at the higher level, and so one of my first big takeaways in just seeing this work progress over the last what are we at, like 18, 20 months now, is just that this is a collaborative effort. And I think we use that word maybe real flippantly sometimes, to say, collaborative, and we need collaboration and all this kind of stuff. But really, if we aren't collaborating, if this work with stepping up isn't in a collaborative effort, it's not going to work. I think we've been blessed in Kansas that we have all these different state agencies that have been participating, and really putting in a lot of effort and time into this work. And I think that we will see great things happen from it as long as we keep working together. If if we're staying committed, we are more likely to see success. When we start seeing a drop in that collaboration is when we start seeing a drop in those successes. And so that was really just my first big takeaway, is just the need for there to be collaboration, and I think that there has been so far in Kansas. Um, the second thing that I would say is, 2 years ago, if you were to ask me or really anyone else involved in the juvenile justice system in Kansas, um, if there was really a problem within the system, if there was a need for services for youth that have behavioral health slash mental health needs, I don't think anyone would have argued with you that there's a need, that there's a problem. Um, Me personally, I don't think I realized how big the problem was. And so, yeah, I think even one of the slides that Steph showed was talking about, seven out of 10 youth in detention have a behavioral health slash mental health need. So in Kansas, a couple of years ago, Kansas passed some legislature a couple of years ago that mandated for all of our juvenile detention centers in the state to start conducting a risk and needs assessment on every youth that enters detention. Um, so that risk and needs assessment was focused on mental health needs and substance abuse needs. And so as we got further into that work, as we identified a tool, as we trained our detention centers, as we implemented that, really about 10 months ago, we're starting to see the data from that, and quite honestly, it was shocking to me. And I think Stephanie even had it on one of her slides, is of our youth that are entering detention in the state of Kansas. And I think we had rounded up on that number. I think the slide said 85. To be exact, 83.5 percent of our youth that have entered detention within the last 10 months have been flagged with that tool as having a mental health slash behavioral health need. And so that was just, like I said, just shocking to me that the numbers were so high. And I think it highlights the need for this work. I think a lot of the things that Kansas has taken on almost came together. This will sound negatively, but almost came together as like the perfect storm. Like everything that we seem to be doing independently kind of all came together at once. And they have worked really well together. And I'll talk a little bit more about that. But I think that need in the detention centers only shows us the equal or maybe even greater need that there is in the community, because we're not even seeing the numbers there of youth that are in the community that aren't even ever going through the doors of a detention center, and then we're not even discussing those that are going through the door. But because detention is a short-term stay, there's always a considerable percentage of that population that isn't in detention for very long, whether it's a 24 or 48, maybe a 72-hour stay. And so there isn't even time to maybe get the tool completed or get a referral made to the local community mental health center, or even to get them in to provide those services. There just isn't time to get there. And so it's, for me, it's just highlighting the need of this. This isn't one agency. This isn't one organization. This isn't one department. This is a community thing as a whole. And then lastly, I hinted at this already, is just one of the things that's really just jumped out to me is just how well Stepping Up has complemented all the other work that Kansas has been doing. We've been involved with the crossover youth practice model through Georgetown University. We've been involved with performance-based standards through the Center for Improving Youth Justice. And like I said, it just seems to be like all these different projects, all these different works, all these different initiatives that are going on in the state, while they each have their own maybe independent focuses, they've all complemented one another very well because of the fact that these youth are touching multiple systems. And we're just really seeing the benefits of the work that we've been doing in Kansas. So I'll stop talking. I'll let somebody else jump in.
Thanks, Clay. We appreciate you sharing. Mario, do you think you could share your perspective as being a pilot site and working on the framework and anything else think is important folks should hear from you today?
Yes, certainly. Thanks, Stephanie. This is Mario Salinas, Deputy Director of Juvenile Programs in Sedgwick County. We're located in Wichita, Kansas. Um, Really, just as Clay mentioned, we were working on a lot of that JDAI work, that crossover youth practice model work, and we identified a significant need for youth and families to be connected to resources out in the community. We get a lot of youth that come in with behavioral mental health needs. And so, as we were working on that JDAI work, we really wanted to focus on some of that prevention efforts and how can we connect those services to youth so they never actually enter our door. So, um, as Megan mentioned, we're one of 7 pilot sites in the state. So, we're very excited to be the first state to implement this for juveniles in the state. So we're excited about this, the collaboration that we've been working on, and trying to identify how we can tie this initiative into some of the existing ones out there. Ultimately, it's our goal to reduce detention and justice involvement, strengthen the families, and then improve long-term outcomes for youth and the community. So we really want to change those trajectories um, for them by providing them with resources. One of the first things that we did was to identify our core partner team. And so in doing that, we wanted to align this group with people that have similar interests and goals. The first member of our core team is the Kansas Department for Children and Families. They have unique expertise in the welfare system as well as information and knowledge on family support systems. We also have the Juvenile Detention Facility that has unique firsthand experience of justice-involved youth. And then lastly, we have ComCare, who is our mental health center, and they have the clinical and crisis response expertise. So those are the 4 that we have as far as our core team. And our goal is really to have a smaller group so we can identify other advisory boards and systems that are out there that we can bring some of these crossover youth practice or these juvenile stepping up barriers and issues to them so we can work collaboratively with that. After the core team was identified, we created our mission and vision. And then, as Megan mentioned, we have started our sequential intercept mapping or SIM. SIM is a tool that helps communities identify key points called intercepts where interventions can prevent deeper justice involvement. And so this was actually created for mental health adults in 2021 for the Adult Stepping Up Initiative, as well as the IDD population. So we're really trying to take this SIM map and identify what specific intercepts need to be changed and updated for the youth population. So we're working on that step with Q2 and working on the community, hospital, and school settings. So we've started meeting with some stakeholders for that process, and we've continued to make some good adjustments with that SIM mapping, and we can plan to continue to meet with other stakeholders as we go through that. So that's kind of where we're at today. We're super excited excited about the initiative. But like Megan had mentioned, we also want to gather some of that data and identify goals and objectives to measure where we're at with providing those resources to not only youth, but their families as well. That's all I have.
Thank you. Appreciate it. Destiny, would you share your perspective from KDADs on the work so far?
Sure. Hi, everyone. Thank you for being here today. My name is Destiny Gillian. I am the Justice Involved Services Coordinator for KDADS. So really, overall, it's been a great experience to work together with other agencies and develop these targeted approaches to help create more access and just collaboration across systems to ensure our youth, and more particularly our justice involved youth, are getting their behavioral health needs met in the community as effective as possible. So, working for KDADS, we have a long relationship working with CSG and Stepping Up. They mentioned our Stepping Up Technical Assistance Center, which was established in 2021, which really focused on strengthening county level efforts to reduce jail admissions among individuals with serious mental illness, and that was more like adult focused. But building on the successes of this initiative, KDADS is really excited to continue the support with this Stepping Up for Youth Technical Assistance Center, which shifts the focus to improving outcomes for youth in the juvenile justice system. Um, and then as well, KDADS, we really just want to ensure our youth are being served effectively, both to prevent system involvement, but also if they become involved in the system as well too. So to promote more prevention along with effective interventions while youth may be in the system, KDADS is currently working on a couple priority areas, which Stephanie had mentioned earlier, such as expanding Medicaid to include more youth-specific evidence-based services, promoting additional crisis respite opportunities for youth at risk of juvenile justice involvement, or even as an alternative to detention, or even supporting our CCBHCs and implementing youth-specific approaches and staffing. So I guess KDADS, we are more than willing to support in this initiative, and we're just so excited to see what success comes from this initiative, just as it did from the adult focused Stepping Up initiative with our TA Center.
Thanks, Destiny. Ashley, do you want to share DCF's perspective?
Yes, thank you, Stephanie. So I'm Ashley Brown, and I'm the crossover youth coordinator for DCF. And in that role, when I was asked to participate in the core team, it really was a no-brainer. Systems and agencies working together to better serve youth and families, heck yes. So it's been really great to work alongside KDADS and KDOC, CSG as a partner with this initiative. And serving on the core team and participating in like the state assessments that CSG did was really insightful for me in learning more than just the DCF world, since that's what I know. And it's really great to see all of this hard work starting to come to fruition with our local sites and things like that. DCF is going to continue to partner with the initiative in a few different ways. We've had our administration involved with the recommendations and forming those and things like that. But also we've got our DCF leadership, such as like foster care administrators, who are participating in all of the local sites. And then I've been working closely with CSG as both of our initiatives roll out, so the crossover youth practice model and the Stepping Up for Youth. And a few of our pilot sites, as Mario said, he's one of the pilot sites for Stepping Up. They are actually fully implemented with CYPM, as well as Shawnee County is fully implemented. So it'd be really interesting to see fully implemented sites now implementing the Stepping Up and how they complement each other, and how we can bring those teams together. But we also have Franklin County, who's going to be a new county with CYPM, and they're a Stepping Up site as well. So it'll be great to see those rolling out at the same time. And I know already that we're forming a team in Franklin County, and most of those members are the Stepping Up members. And so it'd be cool to see how those, complement each other and roll out. While CYPM focuses on the reduction in the number of youth crossing over and becoming duly involved, being placed in out-of-home care, and then decreasing the use of congregate care, and stepping up is focused on diverting youth with mental health needs from secure detention and more effectively serving youth and families. Our end goal is the same. So ensuring that youth and families are served successfully according to their unique needs. So that's all I have. I'm really excited to be part of this team and see how things continue to grow.
Thanks, Ashley, and thanks everybody so much for sharing. And I just want to say that the reason this initiative has been successful is because we have had cross-system buy-in. We have agency leaders really invested in this work and working together. Like Clay said, this cannot happen within one agency. These young people are involved in multiple systems. And really, it requires thinking strategically at the state and local level how to serve these young people effectively across systems. That's why we're engaging in system mapping at the state and the local level to really understand not just how young people flow through a system, but where do DCF and KDOC partner? Are there funding streams that can be better leveraged to support young people? Really looking at it from a cross systems lens is just really critical as you approach this work. And so I just personally want to thank everybody on this call for their leadership within the state to really push us to a new level of thinking and working to serve young people more effectively. And we're excited to bring this kind of framework to other states and counties as we really kind of finalize and formalize our processes and protocols and frameworks at the state and local level. It's been just such a pleasure to work together on such an important topic and really for our young people. So I just want to say thanks. Um, we have done our best to answer questions live as they're coming in through the chat. There's one question about like how are we working with vocational rehabilitation? Um, and I don't know if that's in anybody's agency, but at the state level, that hasn't been a focus. So our focus has really been on what is the service array available to young people? How are those services funded? What are the eligibility requirements? And how do local and state partners work together to ensure young people have access to those services? Really focusing on more behavioral health, like mental health and substance use services. So it hasn't been quite the focus of this initiative. I don't know if anybody feels differently. No. Okay. So, kind of looking at the chat. Thanks, Sterling. We will, as noted earlier, we will post this webinar in about a week or two. It just has to go through process, technology. And then I think we'll be able to send it out to the whole listserv as well. So stay tuned and feel free to share with others and don't hesitate to reach out to us. Our emails are at the end of the PowerPoint that will be posted, but don't hesitate to reach out about questions about our work with Kansas or our work in general. We are excited to partner with other states and counties to really kind of support young people across the country. Megan, any other thoughts? Nope. Okay. Well, thanks so much, everybody. We appreciate your time. Happy Thursday, and I hope you enjoy the rest of the day. Thanks for spending some time with us. Thank you.
Thank you.